Greenspoon from the Social Protection team in FAO Rome. Today, we're launching the Interagency Social Protection Assessment Tool for Food Security and Nutrition, which was developed by a technical working group led by FAO and comprising representatives from GIZ, the ILO, the World Bank Save the Children, IPCIG, and WFP. I'm pleased that we have most of them with us here today. There will be simultaneous interpretation during this webinar. To select your language, English, French, or Spanish, you have to click on the globe at the bottom of the screen. I will be giving some opening remarks and introducing the next two speakers before handing over to my colleague Maya Takagi from FAO to moderate the rest of the webinar. More than 18 months since its outbreak, we're still in the midst of the COVID-19 pandemic. This is a time when we're seeing a reversal of the progress made in reducing poverty in recent decades and a widening of inequalities among as well as within countries. We're also seeing an alarming increase in hunger and food insecurity, but this should not detract from the fact that even before the COVID-19 outbreak, the world was already not on track to meet the SDG commitments to end hunger and malnutrition in all its forms by 2030. Food insecurity had been on the rise since 2014 and then increased sharply last year to affect about 1 in 3 people in the world, some 2.37 billion people who cannot access adequate food. Nearly 12% of the population around the world is severely food insecure, as measured by the Food Insecurity Experience Scale, with women suffering from a higher prevalence of food insecurity than men. Hunger also increased in 2020 and now affects about 1 in every 10 persons in the world, an estimated 768 million people. Even without the pandemic, already 3 billion people could not afford a healthy diet in 2019. At the same time, the rate of progress on child stunting, exclusive breastfeeding, and low birth weight has been insufficient, while progress on child overweight and wasting, anemia in women of reproductive age, and adult obesity has stalled or is worsening. The pandemic has made matters worse, greatly impacting the prevalence of multiple forms of malnutrition. It is estimated that COVID-induced economic contractions and disruptions to food and health systems could result in an additional 9.3 million wasted children and another 2.6 million stunted children between 2020 and 2022, after 2 decades of global decline in stunting. As we know, social protection has played a key role in mitigating the worst effects of COVID-19. Programs such as cash transfers, income vouchers, and food distribution schemes have prevented a steeper rise in poverty and hunger that would have occurred if countries had not stepped in to expand provision to previously underserved groups, increase benefits of existing schemes, and relax eligibility rules, registration procedures, and conditions associated with the receipt of benefits. Social protection will need to feature front and center as countries seek to rebuild their economies. But in a context of uncertain recovery and limited fiscal space, countries will have to search for ways of achieving more with less. For social protection programs, this means making sure that they are designed and implemented in such a way as to ensure they will obtain the impacts on food security and nutrition that typically are among the key objectives of many such programs. It is important too to recognize that apart from COVID-19, another less visible, slow onset pandemic requires attention. Between 1975 and 2016, the prevalence of overweight doubled among adults and grew by more than 4-fold among children and adolescents. Obesity is increasing even faster, tripling since 1975 among adults and increasing more than 8-fold among children and adolescents. In general, social protection programs have not been designed to address overnutrition, which increasingly affects poor and vulnerable populations in both high, middle, and low-income countries. For instance, even at the outset of Brazil's Bolsa Familia, overweight and obesity were already as prevalent as undernutrition among program beneficiaries. But like other social assistance programs, Bolsa Familia, which was at the core of the country's zero hunger strategy, prioritized lifting households out of poverty and protecting them from hunger rather than addressing overnutrition. This is why we're launching the ISPA-FSN Tool today. We have a great cast of speakers from both international organizations and government, so I look forward to a stimulating discussion. We will first hear from Veronika Wozak from ILO, who will make a brief introduction to the ISPA Tool initiative and from Ahmed Raza from FAO, who will give us an overview of the FSN ISPA tool. Then Maya Takagi of FAO will lead us into a roundtable with government officials and representatives from partner agencies. There will be a Q&A session following the roundtable, so please send your questions to the panelists by clicking the Q&A button at the bottom of your screen. Without further ado, may I invite our first two speakers, Veronica first and then Ahmed, to take the floor. Many thanks.
Yes, thank you, Alejandro. So I'm Veronica Bozak, Social Protection Policy Specialist at the ILO headquarters, and also focal point and ISPA Secretariat responsibility. So ISPA, what does this stand for? ISPA tools are interagency social protection assessment tools. So let me start again. So ISPA tools, they are aiming to support governments in improving their social protection systems by providing a tool for collaboration, for a joint analysis of the situation. Can we go to the next slide, please? In many countries, beneficiaries, I need to change. So in many countries, beneficiaries face challenges in accessing the social protection system because of inefficiencies, duplications, bad design, schemes that don't meet the needs, that are underfinanced, that are not sufficiently staffed, etc., and that are not well coordinated. And so the idea of the ISPA tools is to provide a coherent framework for sound analysis of the social protection systems at the different level. There are tools that address system level problems, there are tools for program level, and there are tools that really look at the nitty-gritty details of delivery mechanisms. The tool that we're launching today, the Food Security and Nutrition tool, that looks at how can social protection systems be leveraged to improve food security and nutrition, is at the program level. And so through this analysis of what is the situation in the country, what works well, what doesn't, the tools can help the countries to identify options to improve design and delivery of the social protection systems and programs. All the tools, even if they address different elements of the social protection systems, go through the same steps in their analysis. They map the existing national social protection system. They analyze performance against a certain set of criteria that are both based on national objectives as well as international standards. And then they identify strengths and weaknesses and possible options to address the weaknesses. And all this through a participatory approach that is very much focused on dialogue and exchange of coordination. And the theory of change behind this is that only if you have a good understanding of the current situation, what is currently working well, what is missing, you can move to evidence-based formulation of policy options that can then be costed, and fiscal space can be sought to finance these, and then move towards implementation. Likewise, all ISPA tools have the same structure. There is an overall guidance note that presents the key conceptual foundations of the matter. So, for the Food Security and Nutrition tool, there is an explanation of key concepts for around food security and nutrition, as well as social protection. There is a data collection framework. There is a set of criteria that can help to summarize key findings from the data collected. And there is a suggested outline for the country report. And also there are generic implementation guidelines for how to go about implementing these assessment tools. So as I said, the Food Security and Nutrition tool, it's only one of several tools that have been developed. And this slide shows the overall suite of tools that the ISPA initiative wants to develop. Currently, there are only 5 tools that are already published, and another 5 that we're still working on and hoping to publish in the course of this year or next. So the ones that are now in dark colors are the ones that are already finalized. So how do you go about an ISPA tool implementation? The key important first step is, of course, to ensure ownership. So do a stakeholder analysis, look at who in the government and what other stakeholders at country level need to get involved in the process of carrying out the ISPA analysis. Make sure you have the right expertise around the table, and that you aim to have a participatory process. This is just, I mean, a very quick rush through what we aspire to do with the ISPA tools. And as I said before, the key idea is really to foster interagency collaboration between the development partners, but also at national level, intersectoral collaboration across Ministries of Agriculture and Ministry of Social Development, and Ministry of Finance, Ministry of Planning, and also local level governments, etc. And to bring all these together to take a look at what is the best framework for analysis to assess the current situation, and how do we move to improve food security and nutrition through social protection jointly. And this is just a quick presentation. If you have any additional questions, or you're interested to implement any of these tools, don't hesitate to reach out. And with this, I hand over to Ahmed, I believe.
Thanks, Veronica. And so all the ISPA tools that have been completed can be accessed at that link that Veronica has just shared. And please reach out to the ISPA coordination team if you have any questions. Let's move to the next presentation. It's going to be delivered by my colleague Ahmed Raza, who's the Nutrition and Food Systems Officer at the Food and Nutrition Division of FAO. Over to you, Ahmed. Thank you.
Thanks, Alejandro. You can see the screen, right?
Yes.
Okay, perfect. Thanks a lot, Alejandro. So I think before I begin, I just want to acknowledge that this was a collaborative effort between various divisions at FAO, and also with other partners, some of whom are here, for example, GIZ, ILO, and others. So it has been a collective effort. What I will do is I will quickly go through a 15-minute presentation with all of you, outlining some features of the tool, and also establishing a common ground for all of us, so that we can go into the discussion with a bit more detail. So some of you have heard about the ISPA tool, and some of you may have read the document as well. So you might be aware of the purpose of the tool. Basically, the overall purpose of the tool is to help governments, development partners better understand how social assistance instruments and programs can achieve a greater impact on food security and nutrition at the country level. FSN here stands for Food Security and Nutrition, and throughout the presentation, you'll see this acronym a lot. But more than that, the ISPA tool can also be a way for us to identify and understand existing elements within the social assistance programs which exist on ground, and how they can be strengthened to reach beneficiaries at all levels, individual, household, and community level. Also, as Veronica was mentioning, that ISPA tool can be a great way of supporting dialogue and synergies between social assistance programs, but also with other systems which has links to social protection. So, for example, food systems and health systems. Also, ISPA tool can support the design of policies such that they can be more responsive and adaptive to shocks, and especially considering the twin track approach, which basically entails that the immediate needs of the populations are met, and then followed by focus on resilience building in the longer run. ISPA tool has also been useful, and you will hear more about it from the country examples, in enabling coordination across sectors and line ministries to work on concrete programs and investment plans. Capacity development is also something which can be a great feature of the tool, because the assessment of the tool can highlight areas which need further development, and trainings can be supported afterwards. The tool itself comes in a package of documents, and that package contains a summary of the latest evidence that we have on social protection and its links to food security and nutrition. So this evidence package basically can also be useful in further advocacy and ensuring that at the policy level, the nutrition and social protection linkages are mainstreamed appropriately. As mentioned before, basically the tool follows really closely other ISPA tools, and it has 5 main components. The first component, which builds the foundation of the tool, is the guidance note. And broadly, it contains main concepts and principles which are part of the ISPA tool. So for example, it has information on the food security and nutrition basics. So for example, it covers a lot of ground on the definition of food security, its pillars, the different levels of food insecurity, and the coping mechanisms which people often have to resort to during the situation of food insecurity. Also, it builds on the UNICEF conceptual framework of malnutrition and identifies immediate, underlying, and basic causes of malnutrition, which are important to be addressed. And then also, more importantly, what it does is that it highlights the linkages and pathways which connect social protection with food security and nutrition outcomes. Also, in this guidance document, there is a brief overview of what the methodology of this assessment tool is. And essentially, there are 3 parts to this methodology. The first part is conducting an assessment or analysis of the food security and nutrition situation. So even before the tool is implemented, trying to understand what we know about the state of food insecurity and malnutrition in the world. Sorry, not in the world, in the country that we're working in. And also it identifies where this information could be gathered. So for example, it highlights resources such as FSN, the Global Nutrition Report, the Food Systems Dashboard, and also a host of indicators which can be used to better understand where the food insecure and malnourished are, and what the scale of the problem is. The second part of the methodology basically concerns trying to understand what we know about the social assistance programs and the landscape in the country. And thirdly, trying to understand the program a bit more that we are trying to assess. Also in this guidance note are basically the 7 key areas and objectives around which the whole assessment is laid out. And these 7 key areas are program objectives and indicators, inclusiveness, adequacy, responsiveness, coherence, integration and governance, sustainability, rights, and dignity. The last 2 points, methodology and key areas, are also part of the data collection framework. Okay. As I mentioned, that the package tries to make reference to the linkages between social protection and food security and nutrition. And here you see one example of that. Basically, the tool does a unique job of trying to bring the different sectors that we work on within FAO and also broadly: social protection, agriculture, and health, as well as food. And basically, in this picture, you can see that it lays out the common social protection programs that we see being implemented, such as public works, conditional cash transfers, etc. And then in the middle, basically it identifies pathways such as prices, income, and behaviors, and the interaction of those pathways with mediators, such as childcare and health service use, and how they basically work together to ensure nutrition status. The ISPA tool is unique because it takes the leap to to make nutrition status as one of the key outcomes, which is important because food security often does not itself lead to nutrition security. And there are a whole host of factors which need to be addressed to ensure that good nutrition is in place. Secondly, linking it with nutrition also enables ISPA tool to work more at the individual level as opposed to at the household and community level. The second part of the tool, and if some of you have had the chance to look at the online package, is basically the second document, which contains the data collection framework. And basically the framework provides you information about how to assess elements of the social protection programs that are key for food security and nutrition outcomes. Within the framework, there are a list of data collection ideas and questions which need to be collected through consultation at the country level by working with different stakeholders. Also, within the framework, there is a lot of information about the 7 key areas that I mentioned before. It goes into detail about why we need to focus on some of these areas, what kinds of questions can be included under these areas for assessment, and how this information can be collected. So as an example, just so that it's not abstract, here is an example of within the data collection framework, how the key area of program objectives and indicators is reflected. So objective basically explains a bit about the rationale of including this as a key area. So the objective here is that food security and nutrition concerns should be reflected in both the objectives and indicators of the social protection program, and that these objectives should be based on the assessment of the food security and nutrition situation. And under this key area, there are 3 sub-areas: situation analysis, inclusion of explicit objectives, and food security and nutrition indicators. So for example, under analysis, one key question that could be asked is, was a food security nutrition situation analysis conducted and used to inform the design of the program? If so, which documents were consulted, and what was the level of the source? Was it national or regional, etc.? Similarly, in the objectives sub-area, there are questions such as what were the objectives of the program we're trying to assess, and whether there were objectives linked to food security and nutrition which were included. In the indicators section, also there are questions which are linked to food security and nutrition, and trying to understand basically whether within the program we're trying to assess if there were indicators linked to food security and nutrition. So the results from the data collection feed into the third part of the tool, which is called the overview of findings. So basically here, what we're trying to do is trying to see how the results of the data collection can be classified into 4 levels, as was mentioned before. So basically, there are 4 classifications along which the ISPA tool proposes that the results can be classified. These are latent, emergent, moderate, and advanced. And basically, the idea is that if the results of the data collection are in the latent stage, it basically means that they're quite far away from the existing good practices in that field. So more needs to be done to strengthen some of the aspects of the program. I'll give you a good example in the next slide here. Basically, this is an example of the results coming out of the inclusiveness key area. So inclusiveness as an area includes questions linked to whether the nutritionally vulnerable and food insecure were targeted, and if concerns such as those of pregnant and lactating women and of young children were kept in mind, and if gender considerations were also taken into account. So if the results show that, and if you look at the top left corner, if the results show that there was no direct targeting or consideration given to the food insecure and nutritionally vulnerable, and if the coverage was low, it can be classified as latent in the latent column, meaning it's quite far away from what we normally see in good practices. On the flip side, in the advanced side, basically the results show that the food insecure and nutritionally vulnerable were intentionally targeted and reached. Specific challenges of the target group were included, and if the MNE also included baseline for targeting food insecure and nutritionally vulnerable, we can classify it as advanced. The fourth part is a country report. And this slide is quite wordy, so I won't go into much detail into this. But basically, as Veronica was saying, the tool also provides an example of how a country report could be structured. Of course, these are ideas and they can be changed and modified. But essentially, in the country report, there could be highlights of the main results. Methodology could also be included, as well as findings from the assessment. And the tool itself and the online package has more details on each of these points if someone wants to look more into detail. The fifth part is implementation guidelines, as was also mentioned before. And basically, it provides a process of how the assessment needs to be conducted. It's an outline of steps and activities which need to be undertaken. But the thing to note here is that these steps are basically guidelines and they're not prescriptive. So these steps can be changed, modified, depending on the context and the resources and the data which is available at the country level. This is my last slide. Basically, it explains the implementation process, and I think it's also a good summary of how the assessment could be conducted. This is taken from, again, the online package, which is available on the web, and I've adapted it a bit. So the first part is preparing for the assessment itself, and this could include figuring out what the governance structure could be, who would be in the assessment team, or the AT, here we call it, trying to identify stakeholders, both in the government and non-government, who will be part of the process, and then working through the data collection framework and to get familiar with all the questions in key areas within it. The second part is the data and information collection section. And here, what I was mentioning earlier about doing analysis ahead of time, understanding the food security and nutrition situation, those kinds of things will be completed, as well as translating the data collection framework into something which is more apt for the context that we're working in. The third aspect is the assessment of the performance. So this is where the classification process would be completed, and also a workshop would be conducted with different stakeholders to try to work through these results to validate them and to see if they make sense. And lastly, the country report, which should be a basis for further discussion at the country level on the strengths and weaknesses which have been identified. And with this, I thank you and pass the floor over to Alejandro.
Many thanks, Ahmed, for that presentation. And just to underscore a point that was made by Ahmed, that this has been a collaboration across technical divisions within FAO, and most importantly with a range of partners, and which reflects the nature and the spirit of how the ISPA tool should be also applied at the country level in collaboration and under the leadership and the ownership of government, and with the participation of all the key stakeholders at the country level. The ISPA tool on food security and nutrition has been posted. A link has been posted on the chat box for anyone who would be interested in consulting it. And it's also available in French and Spanish. So you are welcome to look at it. With that said, I will turn the floor over to my colleague, Maya Takagi from FAO. Over to you, Maya.
Thank you, Alejandro. And thank you for the presentation for Veronica and Ahmed. I want first to thank the participants. I see many names in the list, and many partners and consultants that applied the tool already. So you can really help us in the Q&A session as well. So I invite you all to put your questions in the Q&A and even comments and greetings. So as Alejandro said, I'm from FAO, and I worked in headquarters in the formulation of the tool, and now I'm working in the regional office for FAO in Latin America and the Caribbean. And I will moderate a roundtable session, and I would like to introduce the members of the roundtable. So as all tools, the ISPA tools to be approved need to be piloted at country level. So we piloted this tool in Paraguay, in Cambodia, and in Palestine. So we invited the representatives from the 3 countries. We have Rebekah Chavez, leader of the Department of Studies and Diffusion of Ministry of Social Development of Paraguay. We have also Hassan Ashkar, Director General of Planning and Policies from the Ministry of Agriculture of Palestine. We have from Cambodia, Farid Selmi, he's Nutrition and Resilience Specialist from GIZ. So he will be talking from the country perspective, the piloted country's perspective, but also from a partner perspective. We had a very good partnership with GIZ in Cambodia. And from the other partners, we have Luke Harman, Senior Social Protection Advisor from Save the Children, and Andrea Spray, nutrition consultant for the World Bank. They all were very active during the formulation of the tool and the implementation. We also learned from GIZ that the tool is being applied in Malawi. So we have also colleagues from Malawi attending. Again, we invite you all to share your questions to the speakers. So I will start the moderation asking some questions. And the first would be to Rebekah Chavez. Please, what do you see as main contributions of the food security and nutrition ISPA tool for your country? Rebekah, you have 3 minutes.
Muchas gracias, Maya. Es un gusto estar compartiendo este día con ustedes. Un saludo a las personas participantes. Quiero comentarles inicialmente que yo formé parte del equipo que desarrolló este diagnóstico y el instrumento ISPA. Y para contextualizar, quiero comentarles que el instrumento fue utilizado en Paraguay para analizar el programa Tecoporá de transferencias monetarias con corresponsabilidad. Tecoporá es un vocablo en el idioma guaraní que significa buen vivir y hace referencia al objetivo principal que lo dirige, que es mejorar la calidad de vida de la población. Se está implementando en Paraguay hace 16 años y cuenta hoy en día con alrededor de 166.000 familias participantes en situación de pobreza. 29.000 de estas familias son de comunidades indígenas. Estas características situaron al programa Tecoporá como un programa emblemático en Paraguay, y por esos motivos se decidió que era un buen caso para estudiar, analizar y aplicar un piloto de la herramienta ISPA. Sin duda, el primer aporte significativo de la aplicación de este instrumento fue el espacio de reflexión y análisis al interior del Ministerio de Desarrollo Social. Permitió dialogar y consensuar sobre las limitaciones y potencialidades para mejorar los resultados que se relacionan a la seguridad alimentaria y a la nutrición dentro del programa Tecoporá. Con ello también se pudo ampliar la comprensión de los impactos que tenía el programa en términos de SAN, ¿verdad? De seguridad alimentaria y la nutrición, porque inicialmente nos dimos cuenta que si bien el programa tenía un objetivo en mejorar la calidad de vida de las familias participantes, no contaba con indicadores precisos sobre seguridad alimentaria que permitieran medir los impactos que tenía en esa temática. Una mirada más amplia, la aplicación del instrumento ISPA también permitió visibilizar en Paraguay la necesidad de instalar un subsistema de seguridad alimentaria y nutricional, hasta hoy inexistente en Paraguay, y por lo tanto genera ciertos inconvenientes en identificar la rectoría de esta temática a nivel nacional. Les comento que el Sistema Nacional de Protección Social se encuentra en implementación, y un tema que también fue abordado es la necesidad de instalar este subsistema. Recientemente hemos culminado el diseño del Plan Nacional de Reducción de Pobreza, que también donde también fueron tomados elementos de este análisis de la herramienta ISPA, y fueron tomados en el eje de protección social, que posee 6 dimensiones, y una de esas dimensiones bastante relevante es la alimentación y la nutrición, con el objetivo del acceso de la población a alimentos sanos y nutritivos, en forma estable, con cantidad suficiente, y con un adecuado uso durante todo el año. De este modo podemos reconocer que el instrumento nos permitió y nos entregó la posibilidad de iniciar discusiones multinivel en todos los niveles en el Ministerio de Desarrollo Social, al interior del ministerio, pero también con actores claves a nivel nacional. Y permitió revisar el diseño de este programa, la aplicación instrumental y los efectos que genera el programa para vincularlos a un nivel más macro de dar respuestas concretas a la población en situación de pobreza. Después, Maya y participantes de este evento podré compartir mayores especificidades sobre cómo utilizamos esta herramienta. Muchas gracias.
Muchas gracias, Rebekah. Thank you. So now I turn to Hassan from Palestine. Please tell us what were the main contributions of the application of the FSN ISPA tool in your country. Thank you.
Thank you, Maya. Thank you, all the team. First of all, let me thank you and the whole team for this opportunity to share our experience.
Can you speak closer to the mic? Hassan, thank you.
Is it now? How is it now? Maya?
No, not much.
Not. Okay. How about now?
A bit better. Yeah, if you can speak louder and closer to the mic, it's better.
Okay, I will speak louder. Okay. First of all, thank you, Maya, and all the team for this opportunity to share our experience in Palestine for the audience. Now, back to your question. I believe you are familiar with the context, and I don't know about the audience, but the context of Palestine. In Palestine, we are under protracted crisis since ever. The main reason because we are still under occupation. You know, living under occupation, who controls natural resources, segregates the land, restrict the accessibility, and apply blockade on both areas and communities, especially in Gaza Strip. Gaza Strip is a small strip within the country of Palestine, which is under blockade for now 4 to 14 years. Within this context, we have now more than 1/3 of the population are living under food insecurity. Most of them, more than 60% of them, are in Gaza Strip, where more than 80% of the population there are either refugees or refugees descendants. Now, regarding food security and the ISPA tool, we've been cooperating with the FAO, mainly to assess the government policy and the donor-driven programs, or the donor-driven programs which adopted the social protection programs for food to enhance the food security. And you know, this is for food security, the social protection programs are indirectly attaching the food insecurity. They are mainly designed for social protection and for, you know, poverty reduction. Now we had in Palestine, we are applying like two main programs or three programs. One is food assistance, cash transfer programs, as well as economic empowerment programs for poor families or for vulnerable families. The objective is that we were trying to find the best way to address food security enhancement within the social protection programs in a sustainable way. Now, the result or the output that we benefited a lot, at least in the government level, is that we found that, you know, the social protection programs had prevented, let's say, a huge deterioration in the food security, in the food insecurity in Palestine, but for a certain time. But you know, it did not manage to, let's say, to reduce the food insecurity, because it does not affect, let's say, the income for vulnerable households or vulnerable groups. Rather than that, is that programs such as economic empowerment programs for you know, for poor household or vulnerable household, you know, that has a better, let's say, result in let's say, enhancing the resilience of the vulnerable group, targeting food security. Now, you know, this also helped the government through cooperation between different interagencies, through different agencies within the government structure, including the Ministry of Social Development, the Ministry of Agriculture, as well as the Ministry of the Health, that give us the idea how to work together in order to target the nexus. Now we are moving more towards the nexus between, you know, not social protection, rather than social development, agricultural development, as well as health aspects within the context of the government.
Thank you, Hassan. For those, I think if we put the volume higher, we could hear Hassan. Sorry, Hassan, for your mic problems, but for me it was very clear. Thank you very much. So now we go to Farid Salmi. Farid from JZ in Cambodia, another country where we piloted the tool. And I wanted to pose a different question, which is, we are in a new context now, with countries in need to respond and recover from COVID-19. And in a few days, we will also have the UN Food System Summit, which puts social protection as one of the main instruments to enhance food security of vulnerable populations. We saw also the data from FAO in terms of the highest increase in food insecurity and hunger in the world due to COVID. In this context, what suggestion would you give to other countries about the implementation of the tool, taking into consideration the Cambodia experience?
Thank you, Maya, very much. And well, let me start with congratulate the FAO and ISPA team also, and the whole team being involved after such a long process, that the tool is now finalized and being launched, especially at the moment where also just a couple of days ago, the World Risk Report was published, also having a special emphasis on social protection. So there, I guess, there's no better time than today of really having this discussion and exchanges. So thank you for organizing that. Well, when it comes to the food system, well, there, as you mentioned, social protection have a great potential for improving food security and nutrition in all four pillars. But I think, first of all, it's important to realize that during crisis, it's very difficult to have a comprehensive process, bringing all stakeholders together and so on. So there you only can rely mostly on things you already have in place to act fast. I think speed is there very important. But therefore, now where countries are coming step by step out of the crisis, or state of emergency at least, I think it's the best time to step back and to look with the government, with partners, to shape the social protection system of the future. Because we all know, well, after the crisis is before the crisis, and it's just a matter of time and how much time we get to improve and to get better prepared for the next one. So based on that, my recommendation would be indeed to have a multi-sectorial team, to really have all stakeholders from the beginning on board, to get the ownership, and then to go through the 4 pillars. And then looking to Cambodian context also, I mean, improving the access to nutrition, for example, as one of the pillars. You know, I mean, there the big question was also in-kind support to ensure dietary diversity during lockdowns, but also looking into the future diversification of livelihoods, improving availability of nutritious food. There the big question of reducing credit constraints, for example. I think where Cambodia did, because they had systems on place when it comes to enhancing stability and resilience, they had a social registry, so-called ID Poor. Having that in place, it was very good, and to be able to use it and to have to support people not falling under the poverty line, or to respond a little bit to shocks. And through this system, as I said, if systems are in place, you can adapt them, no? And they adapted it to the COVID, and $200 million went through to protect or to support 3 million people, only possible because you had something in place. So my higher recommendation is take the time now, start this multi-sectorial process, and go through the 4 pillars and look what is possible to improve the system. No, not forget the last pillar, improving nutritional advocacy as something we have to start from now on, promoting healthy food consumption patterns and reducing barriers and access to health sanitation services. So that in a nutshell.
Thank you very much, Farid, for your response. Now I will turn to Luke Harmon. Luke from Save the Children, who's a partner for the formulation and implementation of the tool. So Luke, what do you see as the main contributions of the Food Security and Nutrition ISPA tool for the work of your agency? And you can use some examples, or you can use it globally. Thank you.
Yeah, thanks very much, Maya. Well, I'll just say that I'm a senior social protection advisor with Save the Children, but my particular focus has been on how you can use social protection to improve nutrition outcomes, especially for children. And so I was quite privileged to be part of the formulation of the tool. And just before I explain 2 main contributions of the tool for our work, to provide a bit of context, Save the Children has for quite a number of years used social protection measures to improve nutrition outcomes. It's been a core focus of our work in the social protection team. And so as we were inputting into the ISPA tool, we were able to draw on several high quality maternal and child grant programs specifically that we've implemented, which have actually led to reductions in chronic malnutrition in Nigeria, Myanmar, Cambodia, and Guatemala. But in terms of the contributions for our agency, for Save the Children, I would mention 2. So the first really is that the FSN ISPA tool is particularly helpful for us as over the past few years, we've really been developing an internal staff continuous professional development course around Cash Plus for nutrition. So we've been developing a bronze and silver level course to ensure that our staff understand best practice in this area. And so this tool is actually quite useful for us as a reference point as we continually revise and strengthen our internal training. And one reason why it's useful is that, as with all of the ISPA tools, the tool is no exception in being very comprehensive, very well structured, and it covers a large number of considerations. So, for example, inclusion, issues of adequacy, issues of sustainability, rights and dignity, among others. So from a practical level, we can refer to that tool as we continue to refine our own internal courses to make sure that they cover, you know, all of the wide range of considerations that are important for people to understand. The second example I would give is, you know, very practically how we think it will be useful. So when we're in a position to actually support a government or a donor to understand why a particular social protection program is not having the desired impacts on nutrition outcomes, then we can actually use it as a tool, either for consultants that we might commission or even our own staff. We can use it as a tool, as a conceptual framing, and also, you know, use the questions in there to inform our methodology. And we've actually done this previously with the CODI tool to help us assess the child sensitivity of the social protection system in Malawi, Niger and Uganda, among others. So I think we'll be using this again, you know, in those cases where we can advise governments on, you know, how can they strengthen social protection programs to improve nutrition outcomes. And again, it's because the tool is very rich and has very specific questions which we can refer to. So I think those are two examples, yeah, how this tool will be really quite useful for us. Thank you.
Thank you, Luke. Yeah, we know children are one of the main vulnerable group, no, and that need to be prioritized in the social protection programs, and this is one of the elements that is in the tool as well. The targeting mechanism, no, to reach the most vulnerable. And so now Andrea from the World Bank. Andrea, a great partner. Not only the World Bank is the leader together with the ILO on the formulation of the ISPA process, but was a key partner also for the formulation of FSN ISPA tool. So my question for you is, how do you see the importance of the tool in this context of COVID's response and COVID and recovery, and as well on the preparation for the Food Systems Summit? Thank you.
Great, thank you, Maya. Thank you for the opportunity to respond. And let me just reiterate to everyone, congratulations on the official launch of the FSN ISPA tool. I mean, I think it goes without saying that COVID has brought about unprecedented circumstances that have exacerbated longstanding weaknesses in health, food, and social systems of all countries, but most especially of low and middle income countries. In emergency situations, countries need to act fast, and they may need to consider intervention modalities that were never before on the table. During ordinary times, though, and now, more capacity is needed to make social protection interventions more effective for improving nutrition. There's still, I think we're still in the, you know, those of us who have been working on this tool for a few years now, we've been talking about this for a while, but there's still a lot of people, especially working in the social protection sector, that are not yet aware that there are approaches to making social protection interventions more effective for improving nutrition outcomes. So the FSN ISPA tool, which is endorsed by key organizations and translated into other languages, it's an evidence-based and practical resource that is readily accessible to governments and all stakeholders, again, during normal times or during emergencies. But that said, I think that the social protection response to COVID also underscores the importance of having strong food systems and health and social service delivery systems in place before an emergency occurs. I know that during successive lockdowns in my own adopted country of Uganda, people's ability to make a living has been severely curtailed, and what, of course, you know, due to closures and restrictions of movement. But I think that it's also important to remember that the babies conceived at the start of COVID are now 9 months old. And so during this period, did the mothers of lockdown babies receive counseling on foods she should be eating during pregnancy and the importance of breastfeeding? Was she given iron tablets? Was she able to deliver in a health facility? And was she adequately supported to breastfeed? When her infant transitioned from exclusive breastfeeding to eating family foods, was she given counseling on diet quality? And were nutritious foods available and accessible to her? So in my opinion, as a nutritionist, this experience serves to kind of further underscore the importance of considering the importance of not just getting cash into pockets quickly during an emergency, but also, like Fareed, how to ensure that going forward, social protection interventions can leverage, and it can also be leveraged by existing food systems and nutrition service delivery platforms to protect children during the critical 1,000-day period of child development.
Great, thank you, Andrea. I invite you to continue posting your questions in the Q&A button, preferably because this is easier for us to see and respond, but I saw some questions in the chat as well. While other questions come, we will be able to select some of them, but please keep posting your questions, please. I would just like to go back to Paraguay and Palestine as our government's representatives here, and very quickly ask them about after the implementation. Like I think it has been 2 to 3 years that you implemented the tool. What were the main recommendations that you were able to consider in your program or policy process as a result of the application of the tool that is more, let's say, long-lasting, that you would highlight to us, Rebekah, please?
Y Maya, puedo destacar dos cuestiones centrales, una referida al diseño y otra al fortalecimiento de capacidades. En cuanto al diseño, la incorporación de la seguridad alimentaria y la nutrición en la dinámica de un programa que aborda el tema de pobreza es central y no podemos dejar de abordarlo. Entonces, esto es asumido en los procesos de reestructuración del programa, porque una de las cuestiones que nos dimos cuenta es de que se estaban, por ejemplo, potenciando en términos de generación de alimentos, huertas familiares o comunitarias en el programa Tecoporá. También se hacían capacitaciones sobre higiene, conservación de los alimentos, producción de los alimentos a las familias participantes, pero todo esto no figuraba en el diseño ni tampoco tenía una planificación en el programa. Así es que esas recomendaciones que figuraron en el plan de mejora están siendo tomadas y hoy sí se cuenta en la planificación del programa con indicadores y con medidas concretas que atienden estos temas. Otra recomendación asumida es en la dinámica de la mejora continua de las intervenciones fue la necesidad de capacitar a los trabajadores que llegan al territorio. El programa tiene alrededor de 800 capacitadores, o sea, los llamamos guías familiares, y realizan acompañamiento a las familias. Entonces, hoy se cuentan con módulos de formación que serán implementados en la brevedad, donde ya se tomaron temas concretos sobre la alimentación y la nutrición, tanto como contenido formativo para los capacitadores, como la forma en que ellos deben replicar estas temáticas con las familias. Esos son dos temas centrales que me parecía importante compartir con ustedes. Gracias, Maya.
Super, muchas gracias, Rebekah. Hassan, the same question. Please, after the implementation, what you see as long-lasting impact or effects of the implementation of the tool?
Well, thank you, Maya. Again, the best thing that came up from the piloting the ISPA tool, at least from our context in Palestine, is that we learn to work together. Actually, now we have, and I know, Maya, you are familiar with that. Now we have what we call an intersectorial strategy or policy for food and nutrition security, where we have one intersectorial policy that included, for food security and social protection also. That included, production with the protection, as well as for food safety. This is the best thing that we have to have one common plan for different governmental institutions, let's say. This is the first from the planning side and also from the implementation side. Now I'm talking now away from crisis or emergency projects and programs. Now the government of Palestine are focusing on more sustainable interventions and programs that will, develop the capacity or increase the resilience of those vulnerable groups based on economic empowerment programs that will affect the income of the household, which is affecting, the food security as well as health and other aspects. For sure, I'm talking about, rural areas where we have most of the let's say, those economic empowerment activities are related with agriculture in food production and agricultural commodities production.
Excellent, Hassan. Thank you very much. Very important this lesson in terms of we learn to work together. This is very powerful message for us. So now we finish our roundtable. We have some questions in the Q&A and in the chat. So I will start with the one which is, let's say, very important for us who wants other countries to implement the tool. So Patrick Cambewa from Malawi, who is leading, let's say, the implementation of this tool in Malawi, is making an observation, that the testing is a bit long, and how can we make sure we don't spend too much time while ensuring that you get the basic questions covered. I would, so this is the first one. I would like to ask if someone wants to respond to this question about the process of implementation, maybe from countries who piloted it. How did you dealt with the issue of, let's say, the complex and largeness of the process of implementing the tool, and what recommendation would you give to other countries? Luke, thank you.
Yes, sure. I mean, I'm happy to offer some few cents on this, because as I mentioned, we did work with someone who implemented the CODI tool in Malawi, and they didn't implement the entire tool. As you said, some of these tools can be very long. I think maybe there may be a split. I don't know. There may be some purists who say, you should implement the entire tool to make sure that you don't miss out some potentially critical questions and considerations. But I would say, if you're really sure that you can't implement the full tool, I would say it would be good to work with certain experts, particularly those that have strong expertise in nutrition and in social protection, and you may be able to adapt the tool, like choose certain parts of the tool. I mean, I'm giving a sort of general answer there, but I know we had a similar experience with the CODI tool, where we actually used the key principles and key questions of the CODI tool, but actually adapted them to look at child sensitivity, which is not really a core part of the CODI tool. But we really used some of the key questions and principles and applied it, and it was a very good result for us. We felt that it was a very nice piece of research. So I would suggest the key thing is really making sure you get someone who has been part of the sort of design of the ISPA tool, ideally with strong social protection and nutrition background, and there are many people that were involved in that. So yeah, there's just a few cents in response.
Thank you, Luke. I see Veronica also want to respond.
Yes, indeed. I also wanted to say a word on this, because this is indeed a question that we get a lot from people before they start ISPA tool applications. And my key recommendation here is to not be scared of an analytical tool that looks very complex. Indeed, the tool aspires for comprehensiveness because it's generic. It's meant to be applied in all countries, in all contexts, across all continents. And then for the specific application to a concrete country, it is necessary to adapt it also in line with the objective of what you're trying to do with the analysis, and also in line with the time that you have available, the resources that you have available, the expertise that you can get. And so, I mean, as Luke rightly said, it's a question of really sitting down, looking at the tool, look at what is useful for you. It's meant to support you in carrying out your analytical work and move forward. And then be pragmatic. Don't spend too much time on digging the last piece of information that the tool is asking for. I'm always saying, as a rule of thumb, if you get 1/3 of the questions answered, that's already a very good starting point. And there will be, I mean, depending on the country context, there will be a lot of data gaps. And that's also a finding. A lot of countries are not keeping good administrative records. Others are. So you have a wealth of information. That's also a challenge to go through. Others aren't. And then it's important to encourage them to improve also on data collection and management. So I think the key advice to give here is really be pragmatic and make sure you're not the servant to the tool, but rather you use the tool to make it useful for the purposes that you're wanting to apply it to.
Super. Thank you, Veronica, for the words. Well, I see Farid and Ahmed also want to respond to this very quickly so that we can go over other questions. Farid?
Yes, I nearly wanted to raise down my hand again because I can only underline what Veronica said, but let me only add one sentence to it, that we should definitely not underestimate the results of a focused deliberation process among stakeholders, you know? And the process itself can be forceful and trigger changes. So to this time, even you have a very precise question in front of you, this process can have side effects. You're not even thinking about it at the moment. So this really take the process, the way as the goal a little bit, but be pragmatic. So underlining what Veronica said already. Thank you.
Thank you. Ahmed?
Yes, very quickly, Maya. I think one way of potentially reducing the questions is to do a very good secondary research beforehand. So let's say if there are documents which already give you an idea into, let's say, the inclusiveness of that particular program that you're trying to assess, or let's say information is available by way of studies or other assessments which have been done in the area, that should allow you to reduce some of the questions which are in the tool. So I think I cannot emphasize the importance of doing solid secondary data collection. I think that's very important. And some of that, as has been mentioned, will come through as you discuss with stakeholders and you sit down to discuss what the objectives are. But that could be one way of reducing the number of questions.
Super. Thank you, Ahmed, for very concrete examples on how we can facilitate the application. Other question, I think we have some of them here in the chat. I would ask, I hope, Patrick, that it answered your question. Is from Nolar Nestor. So how does food reaches the vulnerable population, example, Cameroon, suffering from war and COVID-19? No, this has to do, I think, with the criteria of targeting, no? How to reach them, how to make them inclusive and let's say impactful for food security for those populations. And yeah, I would suggest to use the example of the elements that are in the tool to respond to this question. And I would like to know who would like to respond to this. Maybe Ahmed, can you? I mean, so that you can go a bit in depth in the criteria, in the presentation that you gave.
Sorry, could you repeat the question?
Yeah, the question is from Nolar Nestor. How does food reach reaches to the vulnerable population. And he gives an example of a country like Cameroon who is suffering from war and COVID-19. So very concretely, how can the tool help a country to make their population suffering from war and COVID to have access to food?
Right.
Or any other.
Yes. Yes. No, that's a good question and a very, very big question. I think one thing that I would say is that most of the social protection programs that we have assessed, the 3 countries which have piloted it, and also social protection programs in general, do reach vulnerable populations and provide them access to food, either through assets or cash, etc. How I think ISPA tool can further strengthen that linkage is one, through identification of vulnerable groups. So we know, for example, that COVID-19 has increased or has introduced new vulnerable groups that we didn't know before. So, for example, they're urban poor or poor who are not neatly following in the categories that we know before. So the identification of some of these groups and the ISPA tool basically can help you reach those groups. So that would be my, let's say, a very short answer to a very big question. But yeah, identification of groups could be a way of reaching stakeholders with food.
Thank you, Ahmed. Anyone else would like to respond to this question? Andrea.
Sure, great. Yeah, just to jump in real quick, I think also it's important to keep in mind that social protection interventions for nutrition aren't always just about delivering food. So there's food transfers, but there's also other interventions that can help nutrition and food security that aren't just about delivering food. And so I think that's one of the important points that gets across really well in the background document of the FSN ISPA is, what do we mean when we talk about food security? What do we mean when we talk about nutrition security? How are those, where do they meet and how are they different? And so I think an important part here is just knowing that sometimes it's not about delivering food, but it's providing access or enabling access to nutritious foods that may already be available in the community through other means. And then I think also another important contribution, again, I think this is actually a pretty, it's a very important and I think somewhat novel tool that's out there, because we really do go into a bit of detail about what we mean by nutritious foods for these specific vulnerable populations, and most especially for that 1,000-day window of opportunity. And so just raising that awareness of, when we're talking about nutritious foods, what are we talking about? So I think in that way, it can also help. Thanks, over.
Thank you, Andrea. So we have, I think we have time for one other question, and I will put the question from Ana Lotero from Paraguay. She is asking the countries how the countries has been implementing the improvement plan that is the result of the application of the tool. So it applies to any other country, Cambodia, Paraguay, Palestine. So do you use still the implementation plan as a mechanism to follow up on the improvements of the social protection programs towards food security and nutrition? I don't know, Rebekah or Hassan or Farid, do you want to respond?
Sí, Maya. Puedo continuar. Bueno, como ya les había comentado, el plan de mejora incluyó varios niveles. De hecho, la herramienta propone un esquema de plan de mejora. Entonces, ¿cómo lo estamos implementando en este momento? dos aspectos centrales que hemos tomado es en términos del diseño, se está haciendo un proceso para mejorar el programa, introducir los indicadores identificados en el instrumento que tienen relación directa con SAM, con seguridad alimentaria y la nutrición. El fortalecimiento de capacidades, como lo he dicho anteriormente, es central. Y esto también, respondiendo a la anterior pregunta, el acompañamiento, si existen facilitadores en los territorios, es central para potenciar la capacidad de las familias para generar sus propios alimentos, si lo pueden hacer en zonas rurales, para también utilizar mejor esos alimentos o los insumos que tienen. Y bueno, eso fue retomado en el plan de mejora a nivel del programa Tecopona. Y bueno, por lo menos se está haciendo un esfuerzo en modificar los manuales de formación de los trabajadores de campo para que exista mayor claridad, tanto conceptual como de herramientas metodológicas que permitan apoyar a las familias en este sentido.
Súper, muchas gracias. Hassan.
Yes, thank you, Maya. In regard to your question, I would say that, knowing better, or the recommendation of the, the tool or the reports of the tool have helped us, to re-budget, even with the government budget, we have now a certain line of budget for social development aspect, where we target, developing small businesses for vulnerable groups, those vulnerable groups or household in the rural areas within the agricultural production. So this is the main benefit, I would say, that was reflected on the government budget, as well as now we have better, let's say, direction for the donor countries in order to target improving or enhancing the resilience of vulnerable groups within the context of creating businesses or let's say household businesses for them, rather than food assistance or cash transfer. The most important issue is that now we have a certain budget line within the government budget targeting social development for vulnerable groups.
Thank you very much. Yeah, I see Alejandro is also helping us in responding online. I'm afraid to open another round and we go over the time because we need to finalize at 10:30 sharp, 10:30 from here where I am, sorry, 3:30 in Rome. So I would invite, first of all, thank you very much for your questions and your contributions and responses from our panelists, excellent responses. And of course for socialprotection.org, our main partner that contributed as well during the formulation, making available the platform for us to interact, and also the space for sharing the launching of the tool. And they will make sure that you get the presentations while we keep receiving Q&A questions and could answer from online. I would like to invite Patricia Farcassi. Patricia is the Senior Nutrition and Food Systems Officer at FAO headquarters. As Alejandro mentioned, from FAO side, we had many partners outside FAO, inside FAO. The main, let's say, divisions that contribute to the formation of the tool is the social protection, social policies and rural institutions divisions, which Alejandro is part, and the nutrition division, which is now Nutrition and Food Systems Division. whose representative now is Patricia, to give us some closing remarks.
Thank you so much, Maya. Distinguished guests, ladies and gentlemen, I'm pleased to be here with all of you for the launch of the Interagency Social Protection Assessment Tool on food security and nutrition, and conclude this interesting and very interactive event. The technical discussions led by FAO colleagues and complemented by the many partners have been illuminating. The interventions from professionals representing the 3 pilot countries were really helpful in understanding the contributions of the tool in making social protection efforts responsive to the needs of the food insecure and nutritionally vulnerable people. We also heard from them about opportunities for improving the tool. The ISPA-FSN tool, at its core, helps to strengthen the pathways through which social protection can enhance the impact on food security and nutrition. I was pleased to note that today's discussion reiterated this important link with food security and nutrition. According to the recent estimates by the State of Food Insecurity in the World report, healthy diets are out of reach for around 3 billion people, and nearly 2.3 billion people lacked access to adequate food in 2020. This is nearly 1 in 3. From a nutrition point of view, therefore, social protection plays a crucial role in increasing the accessibility of safe and nutritious foods through different services, provision of assets, cash, and also knowledge to vulnerable households and individuals. Now that the tool has been successfully developed, piloted, and launched, we can think of ways in which we can champion its uptake and improve its quality. And this event already has generated ideas for doing that. I believe we can proceed on the following 3 points. First, advocate for the use of the tool as a way of establishing synergies within and among sectors for strengthening governance mechanisms, regulatory framework, and policy documents. In the context of the UN Food Systems Summit, the tool can support a food systems approach through ensuring a better alignment between social protection, agriculture, and health sectors. This will also enable us to follow up on the commitments that were made during the 2nd International Conference on Nutrition and ensure that nutrition-sensitive social protection stays relevant on the global development agenda. Second, we really need to address the needs and concerns of vulnerable communities, whether they are afflicted by malnutrition, poverty, social marginalization, gender disparities, or climatic shocks. This represents a crucial challenge in achieving the Sustainable Development Goal. Therefore, the focus of the ISPA-FSN tool on nutritionally vulnerable is one of its strengths and can support better design and effective implementation of social protection. Third and lastly, we heard that it is important to continuously forge meaningful partnerships and encourage exchange of knowledge, especially through South-South cooperation among members and development partners. Again, it is definitely a strength of the tool to have brought together governments, UN agencies, national development organizations, and NGOs. And this is something that we should continue to pursue going forward. I would really like to thank the Social Protection Organization for hosting the webinar and all the team responsible for making this event possible. I wish all of you a good end of the work week and hope that FAO's collaboration with all partners present here can advance in the areas of social protection and nutrition. Thank you so much.
Thank you very much, Patricia, for your excellent words for closing and giving us a more, let's say, forward-looking message for the implementation of the tool. And so I give the floor back to Alejandro if you want to just close from ISP side, NFO. And I thank you all for your participation in this roundtable and the closing.
Thank you so much, Maya, and all the participants. Maybe just to make 2 quick points, which have come up a number of times during this hour and a half. Just to reiterate that social protection programs do not automatically lead to better nutritional outcomes. As was mentioned, good nutrition depends on a host of factors, food intake being only one of them. So it depends also on access to services, to safe water and sanitation. It depends on dietary habits and preferences, feeding and care practices. So there is plenty of evidence that social protection programs do lead to improve food security, lead to greater food consumption, dietary diversity, but there is one other step from the food security to nutrition, and that requires paying specific attention to a number of things that the ISPA tool, the FSN ISPA tool, should be helping you address. The second one is the point about overweight and obesity, which I mentioned during the opening remarks, and actually there was a question from someone from the audience from Kyrgyzstan talking about the double burden of malnutrition. So this is something that I think that we need to think through, because there is limited evidence that the programs such as cash transfers actually do help address issues of overweight and obesity. There is some evidence that they may in some occasions make matters worse. So this is something that requires some reflection.